You touched an infected person. You have 8 days left. Here's why you probably can't be saved, and why doctors will try anyway. Ebola is an RNA virus from the filovirus family. Under a microscope, it looks like a rope with a hook. And it works exactly like that. It latches onto a cell and doesn't let go. There are 6 known species. The most dangerous, Zaire Ebola virus, caused every major outbreak you've heard of, including the 2014 to 2016 West Africa epidemic that killed over 11,000 people. But here's a fact most people don't know. The virus has existed for millions of years, silently circulating in fruit bats without killing them. For a bat, Ebola is just a passenger. For a human, it's a catastrophe. The average incubation period is 8 to 10 days, but can stretch to 21. That 3-week window is the epidemiologist's nightmare. A person feels healthy, doesn't know they're infected, and keeps moving. May 2026. Ituri Province, Democratic Republic of Congo. This is the 17th recorded Ebola outbreak in DRC, and it started just 5 months after the previous one ended. What makes this outbreak uniquely dangerous? The strain is called Bundibugyo, one of the rarest types of Ebola. This is only the 3rd documented Bundibugyo outbreak in all of recorded history. There is no approved vaccine and no specific treatment for this strain. The vaccine that worked in 2019 was designed against Zaire Ebola virus. It doesn't apply here. Among those infected is an American who contracted the virus while working in DRC and was evacuated to Germany for treatment. Cases have already reached Uganda's capital, Kampala. Ebola does not travel through the air. That single biological limitation is the only reason it hasn't triggered a pandemic. It spreads exclusively through direct contact with bodily fluids: blood, sweat, saliva, vomit, urine, breast milk, semen. The virus survives on surfaces for several hours, in fluids for several days. Touch a contaminated surface, then touch your eye or mouth. That's enough. 2 facts people consistently underestimate. First, semen remains infectious for up to 12 months after recovery. Survivors aren't automatically safe to others. Second, the highest risk setting isn't a hospital. It's a home. Around 80% of infections during outbreaks happen among family members caring for the sick without protection, and during traditional funeral rituals where the body is touched. A human body stays infectious for 7 days after death. The most dangerous moment for a healthcare worker isn't treating patients, it's removing the protective suit. One wrong move, one glove slipping, and the virus that was on the outside is now a problem. This outbreak is unfolding in a humanitarian crisis zone. Remote and densely populated areas, active insecurity, and high cross-border movement. These are exactly the conditions under which containment fails. Days 1 to 3. Fever above 38.5 degrees Celsius, sudden weakness, muscle pain. Feels like flu, which is exactly why early diagnosis is so difficult. Days 3 to 5. Vomiting, diarrhea, rash. The virus attacks dendritic cells, the immune system's first responders, and effectively blinds your body's defense. Then it targets the cells that hold blood vessel walls together. Days 5 to 7. In severe cases, internal hemorrhaging begins. Kidney and liver failure follow. You don't die from the virus itself. You die because your body can no longer manage the consequences. Those who survive are the ones whose immune system responds fast enough. Fatality rate, 25% to 90% depending on the strain and access to care. Bundibugyo historically kills around 25 to 40%. Lower than Zaire, but with no treatment available, every percentage point is real people. If you're not in an outbreak zone, your risk is close to 0. But if you are, first, vaccination. RVS Zeboff works on the principle of ring vaccination. Everyone who had contact with an infected person gets vaccinated, along with their immediate circle. Efficacy, over 97%. Second, protective gear. Full suit, gloves, mask, goggles. The most dangerous moment isn't treating the patient. It's removing the suit. That's when it's easiest to transfer the virus to your mucous membranes. Third, avoid contact with the bodies of the deceased and do not participate in rituals involving touching the body. It's culturally difficult, but epidemiologically critical. Fourth, wash your hands. It sounds obvious, but the virus cannot penetrate intact skin. No cuts or wounds, not touching your mucous membranes. And you're safe even after surface contact. CDC has issued a Level 3 travel health notice for DRC and Level 1 for Uganda. If you plan to travel there, postpone. If you're already there, avoid any contact with symptomatic people and do not participate in burial ceremonies involving body contact. The virus does not penetrate intact skin. No open wounds, no touching mucous membranes. You're significantly safer even after surface contact. For everyone else, the most effective thing you can do is stay informed. Outbreaks like this are stopped by surveillance, contact tracing, and community cooperation. Not luck. Ebola won't become a pandemic. The transmission is too limited, symptoms too visible, spread too slow among healthy populations. But in conflict zones without infrastructure, it keeps returning. 17 outbreaks in DRC since 1976. The previous one ended in December 2025. 5 months between them. 1,200 cases. 264 deaths. No vaccine. And it's still growing. Subscribe. If this video made you think, subscribe and drop a comment. Did you know Ebola was already spreading right now? Let's see how many people actually follow what's happening in the world.